Today's video, we will be talking about angioplasty. Angioplasty is a medical procedure used to open blocked or narrowed blood vessels, typically arteries, that supply blood to the heart, brain, lower extremities, or other parts of the body. It is commonly performed to treat conditions like coronary artery disease, peripheral artery disease, carotid artery disease, which can restrict blood flow and lead to chest pain, heart attack, stroke, cold leg, or other complications. Let's talk about 3 types of angioplasty. Balloon angioplasty. A small balloon is inflated inside the artery to widen it. Stent placement. Often, a stent is placed to keep the artery open after the procedure. A stent is a small mesh-like tube. Atherectomy. In some cases, a device is used to remove plaque buildup from the artery wall. These procedures typically follow these steps. Fasting. Patients are asked to fast for several hours before the procedure. Medications. Blood thinners may be administered to prevent clots. Local anesthesia. The area where the catheter will be inserted is numbed. The groin or wrist is often used. Sedation. Light sedation may be given to help the patient relax. The procedures start with catheter insertion. A thin, flexible tube called catheter is inserted into a blood vessel, usually in the wrist or groin. The catheter is guided to the blocked artery using X-ray imaging. Once the catheter reaches the blockage, a smaller catheter with a deflated balloon at its tip is threaded through. The balloon is inflated to compress the plaque against the artery wall, widening the vessel. A stent placement is considered if angioplasty did not obtain the acceptable range. A stent is often mounted on the balloon catheter. When the balloon is inflated, the stent expands and locks into place, providing structural support to the artery. The balloon is then deflated and removed, leaving the stent in position. Finally, the catheter is removed and the insertion site is closed using manual pressure to the access site or a closure device. Let's talk about recovery and risks associated with these procedures. Recovery. Immediate aftercare. Patients are observed to ensure there are no complications like bleeding, allergic reactions, pain, or irregular heartbeat. Rest and medications. Physical activity may be restricted for a short period, and medications are prescribed to prevent clotting. Long-term care. Lifestyle changes, such as a heart-healthy diet, exercise, and quitting smoking, are often recommended to maintain the benefits of angioplasty. Risks. While generally safe, risks may include bleeding at the catheter insertion site, allergic reactions to the dye used during imaging, blood clots or stent blockage. Rarely, artery damage, heart attack, or stroke. Well, that's a closure for this video. Please subscribe and like our channel. It is very important for us to grow as a new channel. I will be posting more contents on several angiography procedures shortly.